Hi, everyone. I'm Lloyd Malech, and welcome to today's Ask Lloyd series. I'm joined by Dr. Jaclyn Halpern, partner clinical director of psychology and the psychology supervisor with Playful Therapy Connections. Dr. Halpern is a licensed psychologist practicing in the DMV and in Delaware. She can also practice jurisdictionally through telepsychology. She brings her expertise in therapy, evaluations, parent coaching, and neurodiversity affirming care. Jaclyn, thank you very much for being here with us today.
Absolutely glad to be here.
And we get
Oh,
many questions at the office concerning, well, questions about children. We spend a lot of time advocating for our clients' children, and we do have many clients with children with neurodiversity. And so let me just start the conversation. When we are talking about families with neurodivergent kids, what does that mean?
yeah, great question. So neurodiversity as a whole means all of the different ways people's brains work. And so neurodiversity includes what we call neurotypical, or kind of the most common theoretically brain that exists. And neurodivergence means anything that is different from that. And so a lot of the time when people are talking about neurodivergence, they're talking about autism or ADHD specifically. But neurodivergence is actually a much larger umbrella. You think about learning disabilities or emotional diagnoses, sensory processing differences, along with autism and ADHD. Anything that's just different than what is considered most typical.
I suppose that would also include maybe dyslexia and other learning disabilities as
Yeah,
well.
exactly.
Or well, are there anything in particular that parents of neurodivergent kids should keep in mind when setting up spaces in different homes? Again, if they're going through a divorce, they're splitting up, separating. Uh, what,
Yeah, absolutely. So, neurodivergent kids, regardless of what kind of neurodivergence we're talking about, tend to be wired in a way where they are just more sensitive to their environment, their relationships, the things going around them. So, even more than we would with a neurotypical kid, we want to think about how do we create a sense of consistency from home to home? How do we make sure that when a child moves from one space to another, they have everything that they need in terms of safety and comfort? We want to think about sensory needs. So neurodivergent kids may well have sensory sensitivities. So what's the lighting like in the room? How is the space set up to help their brain feel comfortable and organized? What's it smell like? What is there that feels soft and comfortable or not, depending on what they prefer? So, really thinking about the materials that are used in terms of furniture, thinking about the different, as I said, smells, sights, sounds, lights in the room. How is that going to be set up in each house that a child might be in each home that they might be in, which is a little bit of a particular need for neurodivergent kids that may not be the same elsewhere. And then making sure that they have their interest objects or activities in both homes. That's going to be even more necessary for a neurodivergent kiddo to have those things that they can go to that feel safe, that feel comforting. There may be things, if it's a certain doll or something like that, that they are bringing and needing to bring from home to home. And then there may be things, let's say they love to play with Legos. Okay, we want to make sure that there are Legos in both houses. It doesn't necessarily need to be that the same ones are moving back and forth with them, but anything that's going to create a sense of familiarity, of sameness, um, that's what's going to matter the most.
and are there any particular attachment-based concerns for neurodivergent kids whose parents are going through a divorce?
Yeah, definitely. So, again, we go back to those more sensitive nervous systems, and neurodivergent kids tend to be even more reliant on their caregivers for regulation, for a sense of safety and stability. And they will pick up on those little changes in mood, those nuances, even more often than other kids. And because of that, it takes parents really working hard to regulate themselves, to very much prioritize connection with their kids. And so this can be particularly hard. Let's say we have a family dynamic where the kid the kid is much more reliant on one parent than the other, and then suddenly, they've got one-on-one time with the other parent, might have to build into that kind of slowly and really work towards developing that sense of safety and relationship. And then for both parents, really taking the time to think about what are my kids' needs and putting connection first, before any kind of correction or discipline, and really working on centering the relationship, because those kids are going to need it. This is a big change happening for them. That's already very hard. Neurodivergent kids tend to be very sensitive to change. They're going to be worried about their parents. We need to think even more about making sure that they are not taking the blame on themselves, that they're not, thinking that this is somehow their fault, they're doing. If their parents are, splitting up, it's even more important with these kids to make sure that you're not damaging the relationship with the other parent. So really working on co-parenting, on making sure you're not putting the child in the middle, whether that's, as simple as carrying a message back and forth, to, saying negative things about the other caregiver, which can be really hard to do. But we want to make sure that we are nurturing the relationship between the child and their caregivers across the board. And so, recognizing with these little sensitive nervous systems and the need to feel safe and to build a sense of, regulation in both homes, particularly because so many neurodivergent kids, they work so hard all day at school to hold it together. They need to come home and decompress, and they need to know that they can kind of take off their mask, relax a little bit, be themselves, and have a parent who's going to allow that space for them in both homes that they might be in.
One of the things that I see in a bunch of cases that I'm handling is, I guess there's an expression we use on the legal side, recruitment. In other words, one parent is trying to get their child or children on their side, aligned with them. And obviously being in the field, we both know that's very, very bad. But could you tell people, what is why it is so bad, so people understand and will hopefully not do it?
Yeah, I mean, what that does is really mess with this feeling of felt safety for a child, and can really disrupt their relationship with the other parent. And these kids, more than any kids, but all kids need, those sound relationships. And it can be very damaging when kids internalize negative messages about the other parent. And yes, of course, there's tension among parents a lot of the time, and kids witness this. And they're
Can talk
going to
about it.
form their own opinion as it is,
Mhm.
but they're also very vulnerable to influence. And so when one parent is putting down the other, they may, either turn against that other parent, or they could feel very defensive of that parent, turn against the parent who's sending negative messages too. It could really go either way. And, what that does for the child is mess with their sense of safety, and, potentially create really high anxiety for them, and have
I
them
see that. I have
yeah,
seen that, just like you're describing. So yeah,
yeah.
obviously, as someone who is a child is concerned, that's Malik law.
Yeah.
We certainly strongly advise our clients against doing it and do everything we can to dissuade them. But we see it on the other side, and there's not much that we could do, unfortunately. But referrals for the
Yeah.
kids. Yeah.
Exactly. And, having a safe space for the kids to have someone to talk to that's not influenced by parent input, like their own therapist, is great. And then also having that support for the parents, whether that's individually working on their own feelings towards the other parent and what's going on with the divorce, but also in terms of learning how to co-parent. And, particularly for neurodivergent kids, because you may be parenting very differently than you would another child. And we want that consistency home to home. We want the discipline to be the same. We want the expectations to be the same, even more than we would for any child who's having to navigate those changes.
Right. And there's also, I'm sure you see it fairly frequently in your practice as well. One party, one parent may
Hmm.
also be neurodivergent,
Yes.
um, whether it is some type of anxiety, post-traumatic stress, or something more along the lines we're talking about, ADHD or spectrum, autism spectrum.
Hmm.
But we see that, and that complicates things. So how do you deal when you are of the belief, for whatever reason, that one of the parents is also neurodiverse and suffering from psychological or emotional ailment.
Yeah, so neurodiversity, we really try to think of that as different brain styles that people have, and helping, just like we would with a child, helping the parent understand their brain style. And it's very common for kids to be identified and for parents not to be, whether that's one or both parents, because we know, neurodivergence is tied to genetics. And so when you have an autistic or ADHD or learning disabled child, there's a very good chance that that at least one of the parents is as well. And if we can help to get to that and help the parent understand how to meet their own needs and recognize, that they may be taking in the world in a different way themselves. And so a lot of it would be about making sure the parent has the care that they need to understand themselves, to get the support that they require, whatever that might be, and to also look at how their brain style or their neurodivergence interacts with their child's and where their disconnect may be there, if any, so that we can work on that unique relationship. And the needs may be different. One parent may need to work on one thing while another needs to work on another, with this final outcome being that we get the parents kind of interacting as similarly as possible with the child so that consistency is there.
Yeah, and again, I also see something where a parent maybe of trying to do what they really believe is best for the child by preventing that child. Let's think of young ones, babies, little infants, from going with that questionably, well, at least the one this is typically happens. One parent questions the capabilities of the other parent, whether it
Yeah.
be neurodiversity or just because they don't like the other person and want to hurt them. But there's that. So how what do you do in those
So,
situations?
I mean, obviously, that's going to be unique child to child. There are times where someone is not fit to,
Mhm.
be a primary caregiver or to do, as much of the care as the other parent. And, that is something, first of all, that we would want worked out completely separate from the child. That would be number one, that the child is not part of those conversations, or hearing the critiques of the other parent. We go back to how important that is, and that decisions are made, absolutely in the best interest of the child. So that doesn't mean that we don't want to hear from the child, how they feel with each parent, because that gives us information about how we can help in both households, but not in a way that puts pressure on the child to be the one that feels responsible for, oh, well, I'm only with this parent this much because I said this thing, or I'm with this parent that much because I said that thing. We don't want that pressure on them at all. We want that decided among the adults.
And
Um,
even among the legal community, and by legal community, I mean the courts and the
yes,
lawyers,
yes,
we generally, and I'm just talking about people who are practitioners, do not want the children to testify. I prefer parent A over parent B. So
yeah,
it happens, but not really. I try not to have ever happen in my cases because
yeah,
again, we don't want to put any child, whether neurodiverse or otherwise, in that
yeah.
kind of situation. So yeah. Hmm.
Exactly. That's just too much pressure for kids, and especially again these more vulnerable kids, they're going to carry that decision and may end up feeling a lot of guilt or pressure around it that can be very harmful.
So, are there any specific ways that that we could aid the transition between the parents? Any advice we can give these parents in specifics?
Yeah, and I think some of that we already touched on, but that sense of sameness. So when kids are moving, we want them to be able to know what to expect in each household when and where we can. With neurodivergent kids, that sense of like a regular schedule is even more important, because a lot of neurodivergent kids struggle with change, and especially unexpected last minute kinds of changes. So we want to give as much notice as possible if there's going to be a change to the expected schedule. We might want to give visuals and verbal so that the kids are kind of aware of what's happening in different ways. We'll want to engage them. And this is actually a really wonderful place to engage kids. And it goes back to the other question you asked about the environment. Like, what do the kids want their space to be like? What do they want in there? What's going to feel good to them to create that safety? What do they want to bring back and forth, that parents may have to help facilitate? If there's that like special stuffed animal, for example, parents want to make sure it's there, not just rely on the kids to do it. If there are babysitters or nannies, if there's any way to have the same person work with the child, across households, that helps too. And we go back again to those parents getting on the same page with, how what their expectations are for discipline, how they handle co-regulation. Ideally, the kids are getting one-on-one time with their parents. That is, child-led, positive time in both households. So anything that kind of creates that sense of safety in both households is what we're going to be looking for.
Well, this information, Jaclyn, is very valuable to families who are navigating the challenges of a divorce. And we really appreciate you taking the time out of your very busy schedule to share your expertise and also to continue to advocate for the well-being of children and families, especially such during such difficult times like divorce. And I think that's something that we certainly are aligned in our individual missions and our goals. But it's excellent to have you come on in. I am glad to have met you, and I'm sure on behalf of the audience out there, thank you very much for coming on in and talking
Thank
to
you
us
so much
tonight.
for having me. Really appreciate it.